Good evening, everyone. Myself, ARSHDEEP, Assistant Professor, Meera Medical Institute of Nursing and Hospital, Abohar. Today, I'm going to explain you about the topic, and I will continue with the topic that was patient classification system. In my previous lecture, I have explained us one part of that lecture about the topic that was patient classification system. Okay, so in the second one, I will explain you about the second part. And in the first lecture, I have explained you about the up to the functional nursing. Okay, the next topic in today's lecture will be the next types of the patient classification system or the patient care system. So it will include it will include the team nursing. So what is the concept of team nursing? First are the features. It was developed in 1950 because the functional method received criticism. A new system of nursing was devised to improve patient satisfaction. Okay, so it was developed in 1950. As the reason, I have already explained that due to some of the factors related to the criticism of the functional nursing. So before going in that topic, so if my voice is clear, so please just give me a message that my voice is clear so that I can continue with the topic. Okay, so let's move on the topic. So team nursing is based on the philosophy in which group of professionals and non-professional personnel work together to identify, plan, and evaluate comprehensive client-centered care. So what is that? As it is clear from the name, it will be including a team that will be able to, or that will have the responsibility to provide the care to the patient. Okay, so as compared to the functional nursing, it includes the work of the different employees. That includes the professional as well as non-professional personnel that will work as a team and provide the care that will include to identify the patient's needs, plan, implement, and evaluate comprehensive client-centered care. So that is the basic thing about the team nursing. Second one is the team nurse provides direct patient care to the patient to group of patients under the direction of RN, that is a registered nurse, team leader in coordinated effort. Okay, so in team nursing, the work we can say that the work is easier because there is less burden on each of the member. Okay, so this team works under the supervision of the RN, that is registered nurse. A charge nurse delegates authority to a team leader who must be a professional nurse. This nurse leads the team, usually of 4 to 6 members, in the care of between 15 to 25 patients. So that is an example that if we are going to, that is a simple example that if we have to provide the care to the 15 to 25 patients in a ward, then our team nursing would be very beneficial because our RN would be a supervisor and all other personnel that RN will delegate the responsibilities or authorities to different personnel that you have to do this and you have to do this. And so in this way, they will be able to provide the services to the medical profession, to the patients. Okay, so that is the structure of the team nursing. Third one is the team leader assigns tasks, schedule care, and instructs team members in the detail of care. What they have to do, when they have to do, and how they have to do. This is all done by, or it is guided by the RN or the team leader. The conference is held at the beginning and end of the each shift to allow team members to exchange information and the team leader to make changes in the nursing care plan for any patient. Okay, so we can say that a meeting is held in which they discuss about the what number of the patients they are having in the ward on the specific day, how they have to work, what are the basic conditions of the patients, and what are the various members that will be working in an effective manner, what each member has to do, when they have to do, and how, and in how they can provide the effective services. So a conference will be held by the team leader, and each and every member would be instructed at what they have to do and to how they have to provide the effective services. Okay, The leader also provides care requiring complex nursing skills and assists them in evaluating the effectiveness of their care. And at the end of the care, the nurse leader, will evaluate that what they have done, what they have to do, what they were supposed to do, and what they have, uh, what are the results. So, is there any difference? He or she will compare. The team leader will compare the expected results as with the actual results. Okay. So, if there is any difference, so they will again review or evaluate the nursing care plan. So, that is how a team nursing works. Next is the diagram that shows the structure of team nursing. It includes the charge nurse, that would be RN, as I have already explained, that would be the team leader. And that will be the main team leader, that will be the charge nurse. Under this, there will be two team leaders, that will be RN, and under this, under a single RN or the team leader, there will be the subordinates who will be working under the each team leader. So these workers like the RN, LP, and NA, okay. So these will work for the patient at the grassroots levels, okay. So this is the structure of the team nursing. Next are the what are the advantages of team nursing? So there are various advantages. Like first, is the high quality comprehensive care can be provided to the patients. So it is obvious that when we are working in a team, so work become easier, and there is a decrease in the burden. So it is the team nursing would be very effective in the providers of the care. Second one is that each member of team is able to participate in decision making and problem solving. So as compared to functional nursing, team nursing will involve the decision making of each member. So that would be an advantage. Third is each team member is able to contribute his or her own special expertise or skill in caring for the patient, because we are delegating each and every person, or we can say that different personals in the providers of the care, that you have to do this and you have to do this. So each and every member will work what with the specialties or the skills they are having. Okay. Next is improve patient satisfaction. So as the we are working in a team, so burden will be less, and we will be able to provide the more effective services. So that will lead to the patient satisfaction. Next is feeling of the participation and belonging are facilitated with the team leader. So uh, each member would feel that he or she is playing some role in the providers of the care. So that will be a sense of respect for each member. Next, workload can be balanced and shared. So that is the main point. That means the workload will be shared, and that can be easily balanced. Okay. Next, division of the labor allows members the opportunities to develop leadership skills. Okay. So uh, it includes division of the labor allows members the opportunities to develop leadership skills. So what is this? That leadership skills, because each and every member is continuing uh, has participated in the providers of the care. So each member is responsible, and he or she will lead to somebody in some care. So there will be the we can say that they will gain or learn about the leadership skills. Next, there is a variety in the daily assignment. Okay, so as the patient changes, so the assignment will also change. Sometimes they will be given the another work, or sometimes the work will be changed, and they have to provide the another care to the patient. Next, nursing care hours are usually cost effective. Okay, and the client is able to identify a person who is responsible for his care. Okay, so it is like that some specific cares are provided by the specific persons, so the patient will feel satisfied. Last, barriers between professionals and non-professional workers can be minimized, the group efforts prevail. So as all of them, if they are rather belong to the professional or the non-professional uh, team, so all of them will be working as a team. So there will be no gap in the professional or non-professional. So that will lead to the teamwork. Next, nurses are not always assigned the same patient, which causes lack of continuity of care. So okay, so same the persons are not provided with the same task, so that will also cause a lack of continuity of the care. Next is task orientation of the model leads to fragmentation of patient care and lack of the time that leader spends with the patient. Okay, so this is about the somewhat demerits, some of the points. Next are the disadvantages. Establishing a team concept takes time, effort, and consistency of the person. As we have to build a team, that will work for the patient, so it will consume some time and effort. So we have to add some of the persons who are skilled enough that they can work in a team. Second, unstable staffing pattern make team nesting difficult. So if there are two or three persons who are not skilled enough, they will create a barrier, and the team nursing will not be effective. Next, all personnel must be client oriented. Okay, so that is the point. Next, there is less individual responsibility and independence regarding nursing functions. So each member is doing a specific task or the work. So there will be the less individual responsibility. Team leader may not have the leadership required to effectively direct the team and create team spirit, and it is expensive because of the increased number of personnel needed. So, as we need a number of persons, if we are going to provide the care to the patient through a teamwork, so that will not be cost effective. Nurses are not always assigned to the same patient each day. So that is the demerit. 2 points that I have already explained. That same patient will not be, we can say that, assigned to the persona. So there will be lack of the continuity of care. Next is a modular nursing. Next type of the providence of the patient care is modular nursing. So what is this? So it includes is the modification of the team nursing and focuses on the patient's geographical location for the staff assignments. The concept of modular nursing calls for a smaller group of staff providing care for a smaller group of patients. The goal is to increase the involvement of RN in planning and coordinating care. So based on the geographical locations, the staff is provided with the assignments that you have to do this and you have to do this. Okay, the patient unit is divided into modules or districts, and the same team of the caregivers is assigned consistently to the same geographical location. So we are dividing in this. We are dividing the patients according to their location or the region. Okay, and then we are providing the care. So each location is or a module is divided to the RN, LPN, or LVN or UFP. Team leader is accountable for patient care and is responsible for providing leadership for the team members and creating a cooperative work environment. So what the work of the team leader is to create an environment, and it is this type of nursing is just the modification of team nursing. Next, the success of the modular nursing depends greatly on the leadership abilities of the team leader. So, as the team leader will guide the persons or the personnel. So that is the main thing, and that what we will get by implementing the uh, modular nursing. Next, what are the merits? Nursing care hours are usually cost effective, and the client is able to identify personnel who are responsible for his care. So that is the point that we have already studied in the team nursing. All care is directed by a registered nurse. So she is acting as a, we can say that the uh, team leader. So he or she will guide the each and everything. Next, continuity of care is improved when staff members are consistently aligned to the same module. Okay, so in this, as compared to the team nursing, we can say that there is continuity of care, and the RN as team leader is able to provide or more uh, is able to involve more in planning and coordinated care. So, team leader can also participate in this type of care as a worker of this. You can say that the type of care. Next, geographical closeness and more effective, efficient communication save staff time. Okay, so geographically they are close and more efficient communication is there between the both of the staff. So the time can be easily managed. Next, feelings of the participation and belonging are facilitated with the team members. Workload can be balanced and shared. So that is equal to the as compared to the team nursing. Next, division of layer allows members the opportunity to develop leadership skills. So in this also, the members can also develop the leadership qualities. Next, continuity of care is facilitated, especially if teams are constant. So if the number of the person that are involved in this team, the continuity of care will be effective and the results will be good. And last, everyone has the opportunity to contribute to the plan, care plan. Okay, so each one can participate in this, and they have the opportunity so that they can implement the nursing care plan. Next are the demerits. Cost may be increased to stock each module with the necessary patient care supplies, medication chart, linens, and dressing. So these are some of the things that will be included in the we can say that the modular nursing. Okay, so it will not be cost effective. There will be the cost can be increased due to some of the factors. Next, establishing the team concept take time, efforts, and consistency of the personnel. Okay, so it is obvious that if we are working in a team, so we have to arrange for the number of staffs and the funds and the various things. We have to deal with the various factors, so it will take time and effort. Next, unstable staffing will make the team difficult, and there is less individual responsibility and autonomy regarding function. Okay, and all personnel must be client oriented. So this is that it will be a client oriented process, and the team leader must have complex skill and knowledge. So to perform the modular nursing, the team leader should be having, or he or she should be, we can say that qualified in the some special skill and knowledge. Okay. Next is the progressive patient care. What we mean with that is, first of all, the future, it is a method in which client care areas provide various levels of care. A central theme is better utilization of the facilities, services, and personnel for the patient, better patient care. So what are the available resources and the facilities? Each and every resource of the facilities used at his best, so the patient care is improved. Here, the clients are evaluated with respect to all level of care needed. Okay, so in this, we assess that what is the progress made by the patient in his condition before, when he was in the first day of the hospital, and then as the time passes, what is the progress in the needs of the patient care. Okay. As they progress towards increased self-care, as they become less ethically ill or in need of the intensive care or monitoring, they are uh, married to units, ward staff to best provide that type of care. Okay, so that is thing that progressive patient care is, in which we assess for the patient for the status identification of the observation for the as compared to the, you can say that the care, the type of care which we have provided. Next is the merits. Each efficient use is made of personnel and equipment. So in this we use each and every personnel and equipment at its best. Okay. Next, clients are in the best place to receive the care they require. Okay. So as we are using the each and every best care that we are having on the resource, so they will receive the best care. Next, use of the nursing skill and expertise are maximized, and clients are moved towards self-care. Independence is fostered when indicated. So we are assessing the client, or we are promoting the, we can say that the patient for the self-care. So independence is be fostered. Efficient use and placement of the equipment is possible, and personnel have great probability of function for their fullest capacity. Okay, so each personnel will do what they can do at their best. Okay, next are some of the demerits. There may be discomfort to the clients who are moved often, and continuous care is difficult. So these are the 2 points. Next, long-term nurse-client relationships are difficult to arrange. That is also demerit. Great emphasis is placed on the comprehensive written care plan. So, as compared to the care, great emphasis is main focus is placed on the by planning the nursing care plan. And there is often time difficulty in meeting administrative needs of the organization, staffing, evaluation, and accreditation. Next is the primary care nursing. What is primary care nursing? So it was developed in 1960 with the aim of placing RNs at the bedside and improving the professional relationship among staff members. So RN is a, we can say that the person who is highly qualified in nursing skills and knowledge. So primary care nursing was, what was primary care nursing, in which an RN was supposed to provide care to the direct care to the patient at the bedside. This model became popular in 1970s and early 1980s as hospitals began to employ more RNs It supports a philosophy regarding nurse and patient relationship. So it is based on the philosophy of the nurse and patient relationship, that is IPR. It is a system in which one nurse is caring for all the needs of the patient or more within 24 hours from the admission to discharge. So it is the type in which we can say that the only one nurse is responsible for the single patient, and each every care is done by that specific person. Okay, he or she is responsible for coordinating and implementing all the necessary nursing care that must be given to the patient during the shift. During the shift, no other nurse will be assigned to that specific patient. Only a single nurse would assist or would provide the care, all the need-based care to the patient, that specific patient. If the nurse is not available, the associate nurse responsible for filling in for the nurse's absence will provide hospital care to the patient based on the original plan of the care made by the nurse. Or in the absence, if the specified person who was assigned to a special to a specific patient, so in the absence of that nurse, another nurse that will be responsible for the completion of the work that was to be completed by the first nurse. So he or she will manage all things, and he or she will now be designated or be assigned that patient so as to provide us the need-based care. Okay, so that is what we mean by the term patient care nursing. So as the diagram shows, patients, total patients care 24 hours per day. It will be done by the primary care. It will also include communicates with the supervisor, consults with the physician or other healthcare, associated days when primary nurse is not available, associate afternoon when primary nurse is not available, associates when primary nurse is not available. If in the days or afternoons or evening, if the nurse is not available, then the associates or assistants will provide care. Okay. Next, advantages. What are the main advantages of this type of care, that is primary nursing care? It includes, first point is primary nursing care is good for long-term care rehabilitation units, nursing clinics, geriatrics, psychiatrics, burn care settings when patients are family members can establish good rapport with the primary nurse. So a single nurse will be providing the care for the long time. So that nurse, he or she, would be having a good rapport or IPR with the family members. So that is first, we can say that the benefit of the advantage. Second, primary nurses are in position to care for the entire person physically, emotionally, socially, and spiritually. Okay, so uh, single nurse is responsible, so he or she will deal with the each and every dimension of the patient. High patient and family satisfaction will be there because there is a single person who will provide care. Most are in responsibility, authority, autonomy, accountability, and courage. Patient-centered care that is comprehensive, individualized, and coordinating, and the professional satisfaction of the nurse. Okay, because a single person is dealing with a single patient, the patient would be satisfied, and the nurse will be having less burden. And next is increases coordination and continuity of care. That is the best point. That means there is a single person, and we can continue care without any problem. Next is disadvantages. What are the disadvantages of the primary healthcare nursing? Primary care nursing. More nurses are required for this method of care delivery, and it's more expensive than other methods because in this a single patient would only be dealt by the single nurse. All the other nurses for all the other patients we will be in the need of a single nurse for the single patient. Okay, so there is a no team. Next, so it will be a more expensive method as compared to the other. Next, level of expertise and commitment may vary from nurse to nurse, which may affect quality of the patient care. So not every nurse will be equally skillful and knowledgeable. So it depends upon the nurse, and the patient care would be effective if the first nurse is on a training basis, or the he or she is a fresher or expertise, that will also affect. Next, associate nurse may find it difficult to follow the patients made by another if there is a disagreement on when the patient's condition changes. Okay, so if any other nurse is will be dealing with the specific person in place of the other, so he or she might face difficulties that plan was nursing care plan was made by the another nurse, but now he or she has to provide the care, so that will also be a disadvantage. Maybe a cost factor, especially in specialized units such as ICUs, may create conflict between primary and associate nurse. Okay, so it can also create a conflict situation, stress of the round the clock responsibility because single person is involved, so he or she will only be responsible for the person. So he or she will be have to do a hard work, difficulty hiring all RN staff, and confines nurse talent to his or her patients. Okay, so that was about the sum of the team managers of the primary care nursing. Next are the case management, and that is the last topic in today's, we can say that topic. So it includes case management. What are the features? Firstly, the case manager, RN or social worker with managerial qualification, is assigned responsibility of the following a patient's care and progress from the diagnostic phase through hospitalization, rehabilitation, and back to care home. For example, case nurse for cardiac surgery patients assist them to go through diagnostic procedures, preoperative preparation, surgical interventions, family counseling, post-operative care, and rehabilitation. Okay, so uh, what is case management, or the what is case manager? We can say that in this person or the health professional will be given a case, so that will include the performance of the various types of diagnostic procedure and the hospitalization. So between this, each and every process will be taken care by the case manager or the case management. Okay, so case management involves critical paths, variation analysis, intershift reports, case consultation, healthcare team meetings, and quality assurance. Okay, and critical paths visualizes outcomes with a time frame. Variation analysis notes positive or negative changes from the critical paths, the causes, and the corrective actions taken. So it will include the different and the complex things, that how a person would manage the a single case. What are the merits? What are the positive points in the patient that he or she is improving? What the basic needs, and what we have to do to improve the situation or the condition of the patient. Okay, case consultation may be indicated when the client's condition differs from the clinical path as noted in the inter-shift report. Okay, so these are the basic things that are done under the case management. In case management, a single person or the nurse has to manage a case. In short, next, what are the merits? So, what are the merits? Case management provides a well-coordinated care experience. That care can improve the care outcome, decrease the length of the stay, and use multiple disciplines and services efficiently. So, when a person is focusing on a single case, so he or she might be knowledgeable about the total condition of that patient. Okay, so that will also include the quality of the care. Second is provide comprehensive care for those with complex health problems. And third, it seeks the active involvement of the patient, family, and diverse healthcare professionals. So, as we have to manage the case, so there is a need of the active involvement of the patient as well as the healthcare professional. Next, what are the demerits? Some of the points of the limitations. What are these? The group nurses identify major obstacles in the implementation of this service, financial barriers, and lacks of administrative support. So these are some of the points or the barriers that have to be dealt while we are performing the case management, because these are some of the barriers. It is expensive, nurse is client focused and outcome oriented, facilitates and promotes coordination of cost effective care. Nursing case management is a professionally autonomous, because the person who will be a case manager, he will do or will be having his own decision making, that requires expert clinical knowledge and decision making skills. So we only need the, we can say that the trained persons or knowledgeable persons or fully trained person who might be taking the decision for the patient, what is good for the patient, what is bad for the patient. Okay, and so what we have to do for the patient to improve his or her condition. So that are about the some of the demerits, and that was all about the today's topic. That was the patient classification system, part 2. So in today's lecture, I have explained you about the modular nursing. Then first was the team nursing. Then was the modular nursing. Next, I have explained you about the progressive patient care. And next was the primary care nursing. And at last was the case management. Okay. So thank you everyone. That was about the today's lecture. And next week I will meet you with a new topic with new energy. So keep in touch with the uh, my individual page, that is ARSHDEEP Singh, as by my name, and you can also join us on the college official YouTube channel, that is Mira College of Mira, Mira Nursing College. So a number of videos, near about 95 to 100 videos are uploaded on that YouTube page, and as well as on the Facebook page of our institution, that's Mira Medical Institute of Nursing and Hospital Abohor. So you can subscribe both of the channels, so you will get the notification for the new videos, and you can share your views or the comments that you need some of the changes. So please keep in touch with us and keep supporting us. Thank you very much, everyone.